Many people critical of the press, justifiably so, for basically towing the government line on everything that's been going on the last year and a bit. A couple of voices have been out there giving an alternative narrative, and one of them has been Toby Young. Now, many people are critical of Toby Young. Nonetheless, he was publishing some useful stuff in the Telegraph, which was questioning the official narrative. And this was one example of it from July, I think, last year. When we've herd immunity, Boris will face a reckoning on this pointless and damaging lockdown. Now, of course, Toby Young also behind the Lockdown Skeptics website, so he's clearly coming from a particular position, and nobody really is in any doubt about that whenever they read this article. This is coming from somebody who's promoting a position, and nonetheless, there was a complaint went in to IPSO, which is the regulator for the Daily Telegraph is part of. Well, they have decided to find against Toby Young for this article. So this article is actually no longer on the Telegraph website. The article was arguing that cross-reactive T cells, although they're not actually mentioned in the article, would provide natural immunity. Basically, newspaper, the Telegraph, was suggesting that Young was saying this. Nonetheless, is that an unfair position to take, that T cells would create herd immunity? Well, actually, there's quite a bit of scientific literature on this, as we've covered in the past. This is from Science. T cell found in COVID-19 patients bode well for long-term immunity. Here's another scientific article here, targets of T cell responses to SARS-CoV-2 coronavirus in humans with COVID-19 disease and unexposed individuals. And this was the key point. Importantly, we detected SARS-CoV-2 reactive CD4 T cells in 40 to 60% of unexposed individuals, people that had never been exposed to SARS-CoV-2, suggesting cross-reactive T cell recognition between circulating common cold coronaviruses and SARS-CoV-2. And this was basically backed up by people that generally are towing the government line in the academic community. So this is Sarah Gilbert here. It's possible we're underestimating the natural or already acquired immunity to this virus. There's certainly evidence that people have not developed antibodies, but have developed a T cell response. And this from Sir John Bell, also from Oxford. So there's a probability that background T cell immunity in people before they see the coronavirus. T cells get a bit tired once you get a bit older, so they may not be as effective at removing a virus. And so he's basically making the point that people who are older have a worse result.
Sometimes due to a vitamin D deficiency, actually.
Yes, indeed.
That was also connected with that.
Indeed. So coming back to Toby Young's article then, here's the IPSO website. And well, the case was brought by one person, i.e. James Whitehead. We don't know anything about James Whitehead. We don't know what motivated him. Is he a doctor? Is he an immunologist? Is he a virologist? We don't know. But this was Whitehead versus telegraph.co.uk. And the basis of the argument was that the Telegraph was in breach of Clause 1 accuracy of the code. The press must take care not to publish inaccurate, misleading, or distorted information or images, including headlines not supported by the text. Well, I wonder where we've seen a headline not supported by the text in the last few days. COVID 2020 saw most excess deaths since World War II. This we labelled as fake news on Monday. It absolutely is fake news. I think that's a breach of Clause 1 of the code, but I don't see the BBC being taken to task by Ofcom for this type of behaviour.
And that's happening on a daily basis. You'll find fake news stories like this in the mainstream media on a daily basis. And Mike, in that complaint, the regulator made the statement, correct me if I'm wrong, that T cells don't confer natural immunity.
We're going to come on to that in a second. So let's get back to the IPSO complaint. They said the publication had failed to take care not to publish inaccurate and misleading information in breach of Clause 1. Really, did they? I would like to know what qualifies IPSO to make that judgment, because I'm not aware of that IPSO is packed with immunologists or virologists or other medical professionals that could make this judgment.
Or maybe Mr. Whitehead is a qualified immunologist.
Well, we can't know that.
But we don't know.
We can't know that. Yeah. Let's see what else. It noted that this statement, this was the T cell statement, we noted that this statement could be misleading in two distinct ways. First, whether cross-reactive T cells could contribute to herd immunity in London, and second, whether London was in fact probably approaching herd immunity. Again, IPSO not qualified to make that judgment. And in any case, was Toby Young making a definitive statement, or was he asking questions, offering an opinion? Well, of course, we can never really find out because the article's now down off the Telegraph website. It is available on the Wayback Machine if anybody wants to go and find it for themselves. But also in the IPSO statement here, James Whitehead said, prior exposure to, this is the point you were raising here, James Whitehead said, prior exposure to coronavirus might lead to cross-reactive T cells, which may lessen the impact of COVID-19, but would not confer natural immunity. T cells would not stop people getting infected at all and would not therefore contribute to herd immunity, as the article implied. Well, I've got to ask then, what does this say about the vaccine? Because the vaccine does not provide our immunity. It merely doesn't stop people getting infected either. It just reduces symptoms. And in fact, quite a bit of narrative that's going on at the minute is suggesting that people that are vaccinated with reduced symptoms may in fact be able to spread the thing themselves. So where does this leave the argument of the need to roll out a vaccine, or even the narrative that the rollout of the vaccine will get us out of this lockdown mess that the government has imposed upon us?
Well, James Whitehead's words are quite telling, Mike. He's saying that T cells don't prevent infection, therefore do not confer natural immunity. Well, what is the definition of immunity? And how is that term described or defined in the medical and scientific discourse or the public discourse? These are much deeper questions. If you want to go into the nuance, there's no way that you could say that that's a statement of fact. To say that we've shown you all the peer-reviewed scientific papers, how many do we have on T cells? I don't know, there's probably hundreds, right? And of T cells is natural immunity. It does confer natural immunity. So in this case, the regulator has got their science wrong. Is it the job of the press regulator to define the terms of science and medical research?
It should not be. It seems to have become so. Now, the key point here is if Clause 1 is all about, well, let's look at what the full definition of Clause 1 is. It says, 1, the press must take care not to publish inaccurate, misleading, or distorted information or images, including headlines not supported by the text. 2, a significant inaccuracy, misleading statement, or distortion must be corrected promptly and with due prominence, and where appropriate, an apology published. In cases involving IPSO, due prominence should be as required by the regulator. And then the next point they make is the press, while free to editorialize and campaign, must distinguish clearly between comment, conjecture, and fact. Well, the point here is, I think, that what we're seeing is the regulator attempting to impose editorial control on a publisher. And this really goes beyond the remit of the regulator. What we're talking about here is a situation where we have a government pursuing a particular narrative. We have a very large body of the scientific community saying that that narrative is wrong. That large part of the section of the scientific community is effectively being silenced by the mainstream press. And in the rare cases where the mainstream press attempts to get some of that information out, then what we have now is the regulator coming along and saying, no, 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 you can't do that. Right? This is very, very dangerous.
They're playing the ministry of truth.
They absolutely, and this is dangerous because this is exactly the same type of situation that we're seeing with respect to social media. So we've got the government attempting to encourage, and with some success, we have noted over the last number of weeks and months, encourage the platforms, the social media platforms, to become publishers and have editorial control. And where that editorial control is not sufficient, the government intends to legislate to regulate that editorial control. So we end up with no platform for dissenting voices at all. This is extremely, as Brian would say, extremely dangerous.
No, not just that, Mike, but just have discourse and debate. You can have disagreements because science itself, scientific dogma, a lot of that is built on assumptions, and often those assumptions become overturned. Why? Because new research has come to fore, new experiments, new results, and this happens every day. That is what science is. There is no such thing as the science, But increasingly, Mike, we see regulators, social media firms, YouTube, governments basically making it up as they go along. They're determining what the scientific line is, what's supposed to be true, especially on COVID. Now, if I was the Telegraph, I would push back so hard on this, and I wouldn't have taken the article down. Sure, you can add a caveat to be more clear, to maybe add a little more detail as to why that was said, what they truly meant. There's nothing wrong with that. But to pull the article down, I would be pushing back against that. The regulator in this case was wrong. Ipsos was wrong. They made a statement that T cells don't confer natural immunity is one of the most ridiculous things that anybody could say. Why would they put themselves in that position to take some sort of a scientific stance and put that on the record? It could be hugely embarrassing in the future.
Yeah, well, I think what we're looking at is full government control of the media here, as you say, a ministry of truth. Now, look, the issue of T cells, hugely important. It hasn't had the media coverage that it deserves, and in fact, not getting the research that it deserves either, at least with respect to Public Health England and Public Health Scotland and so on. So let's have a look at this. This is the SIREN study, and the SIREN study is all about SARS-CoV-2 immunity and reinfection evaluation. That's what the SIREN acronym stands for, and they perform antibody and PCR testing. And in this case, they've presented the results of 20,787 healthcare workers, including frontline clinical staff and those in non-clinical roles from 102 NHS trusts. And they have decided that they had, out of that 20,787, identified 44 possible reinfections.
Possible,
yes. And that's based on the amount of confirmatory evidence available. But this is all based on PCR testing and antibody testing. And there's nothing here about T cells, long-term immunity, cross-reactive immunity, and so on. The government does not want to go there because that would not fit with the vaccine narrative.
Yeah, so the reality, again, we see this time and time again, the reality, Mike, doesn't fit into the policy. And the governments are trying really hard, and some media organizations are trying really hard to force what is physical reality, what's going on in the world, what's going on with COVID, and force it into a very narrow government portal there, and
yes.
It's just not working.